girl here. She's come all the way from Malaysia. The interesting thing is she's been trying to come here for now 2 years, was it?
Yeah.
So she told me yesterday when she came over the first consultation that she tried coming here on Feb 2020.
Yes, sir.
And she's here now, November 2021. I think in between I was a little bugged with her because she used to message me a lot, asking for letters for the visa. And the borders were crazy. They wouldn't give her a visa. I don't know how many times did you apply?
3 or 4.
3 or 4 times, good gracious me. And Malaysia was very easy to go to and come from India, you know.
Yeah, it is.
I've been to Malaysia a few times and it was never a problem. I mean, so it's incredible. Anyway, she's here now with us and her concern is, you know, she's got some swelling on both the sides. And if you look on the side, this is what it is. It's a little bit boxy, squarish, broad, whatever you may want to call it. So we're going to get this fixed today. The plan is to do what I call as angle osteoplasty for want of a better name, but it's basically slimming down this area, both in the horizontal and vertical dimension. That means this is going to go in, at the same time it's going to go up. Why do we do that? Because we need to get this angle better. And you know, the intermalar distance, this is the distance between the cheekbones, has to be less than the intergonial distance. Sorry, this has to be more than this. That's when you get a more angular face. And in her case, it's pretty much the same. It's probably a couple of millimeters less. But she wants to have a nice, slim, feminine face. So that's exactly what we're going to do for her. It's going to be general anesthesia, maybe a couple of hours at most. Nasal anesthesia will be given for her. All the work will be done from inside. I'm not going to do much on the masseter muscle, just a little bit. But you know what interestingly happens with the masseter muscle after we do the angle osteoplasty is that the masseter automatically regresses a bit. This is because its attachment is gone and it's not in as much use as it used to be before, and disuse causes atrophy, right?
Okay, what's repair?
Atrophy is like shrinking. So what I'm saying is the muscle is attached to a bone which we're going to work on and remove that part of the bone. So once that happens, the muscle is not able to attach to where it used to be attached earlier, right? It's missing. So it doesn't attach itself well, and so it doesn't get used as much. When it doesn't get used as much, it gets what is called as atrophy or regresses or becomes smaller in size, which is all what we want, right? That's all going to translate to a aesthetic result. So I'm trying to tell you the functional mechanism between the attachment of the muscle onto the bone that will translate eventually to a more aesthetic, desirable look that you're looking for. Okay, so you have any more doubts? I'm probably going to show you this.
How long it will take?
I already said couple of hours at most. Yeah, not longer than that. Because we're not doing the genioplasty, which will take some more time. So we're just going to... But still your dietary things which I mentioned will stay. So a few days liquid diet, maybe a couple of days, okay? And then, so how was your stay last night in our city? Was it good?
Yeah, good. I was just staying in the room. I didn't go out.
Didn't go out? So this is not the first time I learned from her that she's visiting our state of Tamil Nadu. She's visited here before because I think originally your roots are from here, right? No?
My grandparents.
Yeah, so her grandparents were originally from Tamil Nadu. Okay, I'm just opening this up. While it opens, you have any other concerns? You sure you're all ready? When did you have your last food or drink?
Last night.
Cool.
Right.
So we're ready to go. All right, so this is a scan. These are all shiny. It's because she's got some veneers, some artificial work done. But this is what I'm trying to show you. Maybe here. So that's the little bit of a notching that's caused because of the muscle, which we're going to take it off. And we're also going to remove the outer cortex, which will take the jaw inside. And also she's got a very strong myloid ridge. So this ridge also we're going to trim down to slim it down, to take this part a little bit in. Her chin is pretty nice. She likes it the way it is. So we're not going to do anything to the chin. And even on the scan, you can see the chin is pretty nice and pointy. All right. So we'll see you soon. We'll probably schedule you because you're fasting very soon, okay? We originally thought 1 o'clock, so maybe 1:30. Sounds good? See you. மேலே கொண்டு போய் நேராக அவங்களுக்கு சேஞ்ச் பண்ணி மேலே அனுப்பி விட்டுரு. 1 o'clock ஸ்டார்ட் பண்ணணும். கால் அனந்தகிருஷ்ணன். Did he call you?
Yes, we called around 10:30.
Huh.
Asking any new patients what's our plan. Till the time she had not come.
Yeah, I think she was busy trying to do the